Hi, I'm Ginille, Cosmetic Nurse Practitioner since 2013, here to talk to you about Botox, filler, skin, hair health. Let me know your questions. Jump in the chat if you have them. If you don't have any questions, I will lead the conversation and talk about the most commonly asked questions we hear. I will talk about the most commonly performed treatments that we do. So jump in, let me know. I forgot to grab water. I was actually eating some edible cookie dough. That's not even that great, but I wanted something sweet. Okay, today was a patient consult day. So I do virtual consults with just about all of our patients before they come in, especially with a lot of people coming in from out of state. So I talked to somebody today from New York and somebody else from DC and somebody from Chicago. We like to do these consults just to go through your questions, your goals, tips on what to expect, how to prep for treatments. So this is really a nice time for us to connect and start building out your treatment plan. Then from there, we send you the treatment plan, we send you pre-care and post-care, so then you're able to start getting ready for your appointment. We book out the right time. We make sure that you can bruise, you can swell. There might be things that we need you to start using or stop using before your treatments. So this really helps people make informed decisions about getting their treatments. I love doing the virtual calls. My team also does virtual calls. And when the patients come in, they're ready, they're informed, and they're able to do their treatment that day. We see our patients forever. So I also tell people, I'm with my patients forever. Some of these people I've been treating my entire career. I've been a cosmetic nurse practitioner since 2013. So 13 years. We've got 3 locations. Jossie Skin and Wellness. You can find us in Los Angeles and in Las Vegas. The clinic was formerly under my name, Ginille Beauty Aesthetics, if you want to look up more stuff too. The most commonly performed treatments that we do in our office are non-surgical treatments is everything that we do. Skin treatments, so we've got chemical peels, microneedling, laser, hydrofacial. We have a whole skin membership program where people come in on a monthly basis. We do different skin treatments depending on their skin concerns and their goals. I don't want to just be like, oh, you're only going to come in for laser, because you might come in and have like a different skin concern, the weather change, you have a breakout, whatever. And so we might need to change modalities. Very often our patients are combining modalities. So they come in and they're doing multiple skin treatments on the same day. So somebody might do the laser followed by the peel and a hydrofacial all on the same day. And then they prep their skin and are doing injectables as well, especially when we have people coming from out of town. So we're able to work on different layers in the skin and do injectables. Most commonly performed injectables we do in our office are the natural filler. And so this is PRF EZ Gel. This is a filler alternative made entirely from your body, your blood. We draw blood from the arm, and we separate out your growth factors and stem cells from putting it in the centrifuge, the spinner. From there, we take that part, we heat and cool it so it thickens and makes a gel, and we can inject that anywhere in the face. So wherever we inject it, your body will make new collagen over time. And then Brandy, I'm gonna ask your question in just 1 second. And so patients really like that because this is a way for new collagen to happen. It looks very natural, the results. It's not here to give you instant results the way filler can. A lot of people don't want filler, or they're not candidates for filler. And a lot of people want the natural collagen stimulation. We're all losing collagen as we get older. So this is a nice way to help your body jumpstart that collagen. Okay, Brandy said, what would you recommend for a 39-year-old woman with acne scars and pits? Hey, Brandy, and looks like you are woman of color. Okay, we see all skin types and tones in our office. Anything I talk about, safe for black and brown skin, we see everybody every day. Acne scarring at home, tretinoin is going to be really good. So we prescribe and dispense that in the office, or another retinoid. If you cannot tolerate a prescription tretinoin, if that is too strong for you, retin-A too strong, we'll do our Jossie Resurface RX serum. So this is a medical grade retinol that is going to help turn skin cells over faster, helps with acne, helps with dark spots, fine lines, pores, helps with the texture of the skin. So do that at home. Make sure you're using your sunscreen and reapplying. In the clinic, we will be doing a combination of skin treatments, very likely Aerolase laser, and then skin pin microneedling and the bio repill. You can do them on the same day. If it's your first time, if you've never had any skin treatments, I might not combine them all on the same day. As we see how your skin responds, that's when we can start stacking those treatments. When we stack the treatments, people are able to get to the results faster. They are working in different layers on the skin. So that is really nice. We treat a lot of acne and acne scarring in our office. working on the texture and the scarring has to come after acne is controlled. So if you're like, hey, I'm not breaking out anymore, cool. That's when we can work on acne. If you're still having breakouts, we can't do skin pin microneedling. We don't want to spread bacteria in the skin, but the Aerolase laser and the Bio Repel works really well for treating acne. We also have a Black dermatology nurse practitioner on our team, Niani. She has helped develop and create a lot of the protocols for our team in doing the whole skin treatments alongside me, and she's just excellent. So sometimes I'm like, hey, let's see Niani, but we do prescribe and dispense prescription medications in our office if we need to. Okay, and so a lot of this, guys, it's in office what we're doing in clinic, but what you're also doing at home. So it's not just like what we do, we're getting you prepped so you're using the right things. People will come in and they're like, I'm using all these random products that I got from, you know, the store. And like, when I look at the ingredients, I'm like, oh, these products are not like moving in trying to work on your skin concerns. So we'll get you with the right skincare. Okay, let me see if I'm trying to go back and read these questions. Sabrina, you're so glowing, angelic looking. I need all the tips. Thank you, Queen Sabrina. God bless you. You're so beautiful. Thank you so much. Sabrina, you're so glowing, angelic looking. I need all the tips. Thank you, Queen Sabrina. God bless you. You're so beautiful. Thank you so much. Why do I hear a lot of people talk about PRP doesn't work, Mrs. K? So I think a lot of people are really uninformed on how PRP works. So there's a couple of things. When we do PRF EZ Gel in our office, there's different things. Regular PRP and PRF, they're really great. But what we do is we take it a step further by heating and cooling your PRF, your PRP. This is all from your blood draw. This is the natural filler I'm talking about. When we heat and cool it, that is going to thicken it and make it into a gel. You'll get a little bit of a lift when you have that thickened product as opposed to just injecting the liquid. So that's cool. You get, hey Shelly, thank you so much for the hearts. That's really cool. You get like a little bit of a lift. I'm not really caring about that instant lift. That is not the intention with this. When we're doing this EZ Gel, we're working on collagen stimulation long term. Regular PRP, when you just inject it in the skin, if you didn't heat and cool it, it lasts in the skin. Like those growth factors, the exposure that stays in the skin is for like 3 days. PRF, platelet rich fibrin, is like up to 3 weeks. When we heat and cool it, it helps proliferate, like make more of those growth factors and stem cells, and it stays in your skin for up to 3 months. So that's nice because your skin is going to have a longer time to be exposed to the growth factors and stem cells to make new collagen. I will say, we do this in a minimum of 2 sessions. We want to retreat the same areas. Younger, healthier patients are going to have better outcomes. So like our 20s to 50s, they really like it. Mid 60, okay, we might need to use something else. We might need to use traditional filler or another form of collagen stimulator. But healthy patients that aren't drinking and smoking drugs, have a healthy diet, overall like healthy lifestyle, they have really great outcomes. Most of the patients coming in to do this are overall pretty healthy. Really good outcomes with it. It gets better with time. So a lot of times if I see somebody comment, oh, I did PRP, it didn't work, I'm like, tell me more. Like, how many did you do? If you did 1 session, that's not it. Also, when did you do it? People be like, it lasted for 2 weeks. I'm like, it didn't. What you saw for 2 weeks was like some initial swelling. This is one that gets better over time. It can take up to 6 months to see the full results from this. So this is what we tell our patients. I'm like, if you want instant, this is not the instant. If you want instant, we can talk about filler. This is one that will gradually get better. Some people, and I can visibly see it and on photo, like even after they do 1 session and they come back for their second session, like a month to 2 later, I'm like, dang, it looks better already. And they are happy and they're excited. Sometimes people are like, I don't see it yet. I'm like, okay, I don't expect to see it just yet. It can take up to 6 months to see the full effect. Even for the patients that tell me they don't see it, they come back a year later. And I'm like, hey, you're here. Like, I thought you didn't see it. How are you? And they're doing the same thing. And I'm like, why are you doing this again? They're like, oh, I didn't see it when I saw you. But like 4 months later, 6 months later, they're like, I saw it. They're like, oh, I just didn't look so tired. Oh, the lines didn't look so deep. My skin looked glowier. So I'm like, it works. You gotta give it time. I think a lot of people just don't understand. This is one that progressively gets better. It's not an overnight fix. I have only been doing the natural filler for the past 2 years. You guys know I have this baby. I've got 3 babies. This last one is 2.5. I've been breastfeeding him the whole time. I haven't had filler for over 3 years. This photo of me before is me prior to doing any filler. This was 10, 11 years ago. My oldest is 11. I always breastfeed the kids for 2 to 2.5 years. And then I look like that, really sunken and hollow after doing after breastfeeding because they suck all the fat out of me. So these last 2 years, I've been doing the natural filler. I've been doing it because there's nothing mixed inside of it. Like, you can't do stuff if you're pregnant breastfeeding. For me, I'm like, okay, nothing is mixed inside of it. This is all just from my own body's growth factors and stem cells. I've placed it in all the areas where I usually do regular filler. Temples, under eyes, smile. Like, I've done all the spots and I'm like, dang, I don't look so haggard. When I very first did the first session, I was like, I don't see any change. I was feeling just like all the people. I don't see any difference. Over time, I'm like, dang, I don't look as beat up. I never reverted back to that. And that's 11 years ago. 10 years ago, he's 11, so I don't know how long. 10, 11 years ago, I don't look like that. I don't look so haggard. I don't feel like I look so tired. I'm not rushing to try to get this baby. I mean, I would like for him to stop feeding. But like, I'm not trying to get him off so that I can go and like do filler. Usually I feel pretty self-conscious this long out without having stuff and like losing the volume in my face. So I know what works. My patients know what works. They love it. You just got to know it gets better over time. Instant fix. This is not the instant fix. Okay. I talk too much, guys. You know, I take 20 hours to answer one question because I want you to really understand, like, all of these things when I'm here, guys, it's to help you make an informed decision about doing treatments, not a rush decision. That's not what we're about. We are in for the long-term game. Long-term game. When I have my patients, like I said, some of these people I've been seeing my whole career, but some of these girls, 5 years, 10 years, whatever, they look hotter and like themselves and more useful than when we started. Like, they age and they look better. And like, you can see it, but they don't look done. Like, it doesn't look weird. It doesn't look augmented. They look like themselves. They look fresh. It doesn't look like, oh shoot, she's pumped full of Botox and filler. That's not the style. Their faces move. They look very natural. Gosh dang, you guys have seen a lot of them on dang social media. A lot of them are creators and influencers and all that. And they just look good. That's the point. It's not here to look done. You know, I don't want someone to be like, oh shoot, you did your lips. No. Like, we need everything to be undetectable. That is, yeah, we can do your lips and I can make them juicy and make them pop. However, I got to make sure we're thinking about all the areas. We're framing the face when we do any treatment. If I just treat the lips, how is that going to impact the rest of the face? Can't just do lips and have saggy corners and like a set back chin and the lips are protruding over. So this is what we call facial balancing. That is where we look at the full face. We are not here to spot treat. We're not here to say, oh, I got a smile line, just inject my smile lines. If we only inject the smile lines, okay, cool. But then like the cheeks are sagging and then you got these lines that are sagging, like it's not gonna look right. So when we inject in our office, we are considering the full face, how your face is aging. We are asking so much about your lifestyle. Oh, have you changed weight recently? Are you trying to change weight? You have events upcoming. Tell me about like, what do you do? Oh, you exercise all the time and like, you don't have any downtime. Oh, you fly all the time. So you don't have, oh, you're always on camera. These things help us try to figure out what treatments are going to serve you and how, and like our timeline. So we know a lot about the patients that we're doing. It's not just a random thing. We're not just here to like poke some Botox and be like, yeah, you're done. See ya. No. There's like so much that goes into it. And there's a lot of thought behind each and every action that we make in the office. Okay. 500 answers for one question. I'm sorry, 500 minutes for me to answer one question. Lisa, how many times should I do microneedling? I just had my first session 2 weeks ago, 37 years old. Depends on what your skin concerns are. If you had, so somebody earlier was talking about acne scarring, we might be doing 6 to 10 sessions, depending on how severe the scars are and how long they've been going. In general, skin rejuvenation, minimum of 3. You want to spread them a month apart. If you are trying to target something specific, deep acne scars, more visible lines. If you're older, you have more lines, you want more collagen stimulation, that's when we're going to be going like 6. So just depends on what's going on. We might be combining this with the laser, with the peel the same day or alternating them. If you're just trying to do overall skin rejuvenation, I would do a series at least 3. Araceli, if I recently got under eye filler, I'm not completely satisfied. Should I just leave it alone? Araceli, tell me more. If you did your under eye filler in the last 6 to 8 weeks, it is still settling. So when you do your filler, anytime we do filler, anywhere in the face, I tell patients, all right, you could either love or hate when it looks swollen, but it's going to be swollen for like, most noticeably the first few days, 2 to 3 weeks. After that, like the swelling is getting more and then it starts coming down 2 to 3 weeks. By like 3-ish weeks, you have a pretty good idea of what your results are going to be. However, it will still settle a little bit more. So 2 to 3 weeks, let me know I don't know, Araceli, when you did it and how long and how much you did. But if it's the first few weeks, it's not enough time. It can take up to 6 to 8 weeks to fully settle. when we do filler in our office, every patient knows, I'm like, do some, let it settle. We reassess, wait 6 to 8 weeks. I will not re-inject this. None of my team will re-inject the same place if it's before 6 to 8 weeks. The filler has not settled. When we start trying to rush, people go, oh, I went every 2 weeks and I kept adding more to my lips. Oh, I went back a month later. The filler hasn't settled. And so they're just like adding more. And that's when people say, it migrated. No, dude, you just did too much, way too fast. Like, let it settle. Don't manipulate it. Let it be. You might feel little lumps and bumps. They settle at 6 to 8 weeks if they're using the right products. Old school products, they leave lumps and bumps, I think. So I don't even buy old school stuff in our office. So yeah, I don't know when you did Araceli, but hopefully that helps you. Okay, Brandy said, thank you. Oh man, I went all the way down and it had 60 messages. So I'm going to go back up. Let me see if I can, I'm trying to scroll to see back to the, where I was at. Any recommendations for age or sunspots? For Shelly said, please, first and foremost, sunscreen, and reapply it. Most of us are not wearing enough sunscreen and reapplying it daily. In our office, we see all skin types and tones, black and brown skin. Yes, you need to wear sunscreen too. Yes, you need to reapply it. People will be like, oh, you wear sunscreen? They're like, yeah. I'm like, tell me what time you apply it. They're like, when I go to the beach. I'm like, that's not enough. Tell me what, like, I do it in the morning where it's mixed in my moisturizer. I'm like, that's SPF 15 and that is not enough. You got to reapply. I'm in LA. I'm in Vegas seeing patients. Dudes, we drive in Vegas. Vegas, the skin is not looking good on these patients. Y'all look dehydrated and the sun damage is bad. Sunscreen it up. LA, anywhere you drive in LA, you got to be putting your sunscreen on. We're going to be staying in the car for an hour. So sunscreen, if you're sitting in work and you have windows next to you, some people are like, oh no, I'm at home, but I'm like doing their consult and I'm like, you are sitting next to a window. Like, stop it. And so you want to be mindful of that. Sunscreen, main one. At night, a retinoid. So you can do the prescription Retin-A, or you can do Jawcy Resurface RX serum. So the retinol. In the morning time, vitamin C serum. We got Jawcy vitamin CE. So that's a really good one. That helps with brightening. In the office, BioRepill, really great for brightening. Aerolase laser and the skin pin microneedling, really great. However, if you're not going to wear sunscreen, I'm going to tell patients don't even do the skin treatments. So main thing is sunscreen, avoid the sun, or be mindful of your exposure, and you're heavy on your skincare at home, your retinoid, your vitamin C, and then your skin treatments. Okay. Let me see if I'm doing it. Sorry. Araceli, okay, I got both those questions. You're gorgeous. Wish you're in Miami. Shelly, I was really trying. I did Vegas. I was trying to get to, I see a lot of patients out of Houston and Dallas. So Texas, Miami. I see a lot of Florida patients, a lot of New York, and Atlanta. I was trying to go Texas. They were trying to make me take another like a Texas history class to get my nurse practitioner license. I'm like, dude, I've been doing this for a long time. I went to Stanford. I went to Duke. I have enough student loans and I have enough education. Like, I've been doing this a long time. I didn't want to take the test. I should probably just take the test because I have a lot of patients from Dallas. And then Florida, I got my license really fast there, but it's like really hard to get a medical director in Florida. So that's why I did Vegas. Vegas is a short flight and it's great. And we see a lot of patients from Vegas anyway. So, okay, At said, how do I find out the cost of facial balancing? So facial balancing, when I was talking about multiple areas of the face, assessing your face, all the different angles, looking at how your features play one to another, not just doing cheeks, big cheeks and then sunken here, or just lips, and then we got to think about the full picture. It depends on your face, and everybody's face is different. I will say, in general, people are usually doing around 2 to 3 syringes for like this area and 2 to 3 syringes for this area. Now, that's going to depend on the person. Some people have really short chins. They're going to take more. Some people are older and they have really, really saggy. They're going to take, it's the range is there. So I would say 4 to 6 syringes. You can noticeably see some change with that. Like, most of those patients you'll see, they have that many syringes on my page. Like, they have had multiple things when we're hitting up these areas. And remember, we do it over time. 4 to 6 syringes, you'll be able to see it. They're $9.75 a syringe. So you can say around $4,000 to $6,000. When we do facial balancing, like I said, we break it up into a couple sessions because you can bruise, you can swell. I don't want it overdone. We never want to overdo this. We need it to settle, reassess, do more later if we desire. If it's perfect, we're not trying to overfill. Maintenance is going to be around 1 to 2 years. We kind of check in. If it is looking great, we don't want to do anything. Like, I'm like, sometimes people are like, should we do it? I'm like, no. Like, I'm looking for how light hits off your face. I'm looking for if there's like deep shadows somewhere. Again, looking at how your features play with one another. and does it look natural? Like my eyes naturally, without me trying to like do it, like I just look at how light hits off the face. It's just what I do. So if nothing is like immediately there, I'm like, oh, don't do it. Like I don't see anything. Or I can get really picky if somebody's like, tell me. I'm like, okay. Look, usually the common areas, under eyes, and then they'll get this line like through the cheek. So you could probably see it on yourself, but people get this line through here. This is where fat pads separate. The smile lines start to get deeper. This right here gets really deep because we lose bone here. The corners of the mouth start to deepen here, and then our chins start to sit back, and then we get this, we call it pre-jowl sulcus. So this is like, this area starts to sink because this fat pad comes down. So, and then temples, they'll start to hollow. When we do under eyes, we want to think about all the shadows, and you can see a little shadowing on me here and there. I don't want it to look weird, but again, we want to think about the whole face. Maintenance between 1 to 2 years. If it looks great, we don't want to do anything. Keep an eye on it. When they do maintenance, we usually don't have to redo all of it. It's not like, oh, you did 6 fringes last time, I'm going to do 6 fringes again. It's like half, or it's like me like kind of piecemealing. There was a girl I saw the other day from Wyoming. Where is she at? She lives... She's like, oh, all the billionaires live there. You need to come there. Anyway, we did her stuff 2 years ago, and she was like, should I do anything? I was like, nothing is like standing out to me. She's like, but like, you see anything? I was like, okay, I see little shadowing here and little there, to like stay on top of it because she's not here all the time. She's like, well, I am getting ready to do some presentations and So I actually have the downtime. So we did like 2 syringes to just like hit those areas and maintain, not to overdo. Okay. And that was her maintenance from 2 years ago. What about for smile lines? Brianna, smile lines, you can do filler or the natural filler or another type of collagen stimulator. When we're doing smile lines, here's what I tell people. I talked about smile lines a lot today on my virtual calls. One girl's like, I want them gone. I was like, well, we're not going to get the smile lines gone. Like our face is still going to move. So you're going to have smile lines. It's not going to be a filter where there's nothing. We can soften them. We can like put some support so the depth is not as deep, but we're not trying to get them all the way away. Trying to chase and get them all the way away, it's going to look overfilled. It's going to look weird. You guys have probably seen people walking around the streets that they look like blown out. Like you don't want that. Other things when we're doing smile lines, I got to think about the full picture. We're always thinking about the full picture. What is causing these to get deeper? So losing bone here. And then right here, are these fat pads pushing down? So sometimes it's not just smile lines. It's also doing a little bit of filler into the cheeks to help create a highlighted look where things look lifted. It's not pulling you back, but things look lifted. Light hits off the face brighter, and then soften these. Sometimes I don't even chase the line. I just hit this right there, and like it just looks better and still very natural. Smile lines is not the first place I inject on people. It's usually like the icing on the cake. So Carmen said, what filler is this? Through here, I've had a lot of fillers in my face. The last 2 years, I've been doing the natural filler, PRF EZ Gel. I haven't had regular filler for over 3 years. I've had Voluma, Restylane Lift, Radius, like different ones. Parts of my face I've treated, temples, under eyes, right here, corners of my mouth, and my chin. My chin was more set back before. I've done Botox, frown, forehead lines, like around the eyes. I've done all the skin treatments, and those I'm very consistent with. Bio Repeal has been one I've really been into. Aerolase, I love. Skin pin microneedling, I probably do the least of, even though that is like very, very great. Because I'm filming so much and I got little kids, you gotta like really be mindful for like 48 hours to not have anybody like touching your face, like hair off your face, hands off your face, like, yeah. So there's like the most downtime with that. It's not crazy downtime, but it's the most one you gotta be careful with. So that's probably one I do the least, but the other two have no downtime at all. Hydrofacial is great if I can find one of my team members to like do a hydrofacial on me. What other things have I done? Those are the main ones. Botox my neck. I've done fat dissolver underneath my chin. I like that. Guys, it takes a lot. So I just tell them, like, people are like, should I do the fat dissolver? If it's like a lot of heaviness, I'm like, just do surgical, or at least get a surgical consult if you're open to it. Yeah. Okay, so I say pretty, thank you so much. We'll never do cosmetic procedures again. I did pico laser with a known doctor. It messed up my skin. Sad to say, said that. Yeah, we don't have pico in our office. Yeah, I don't know what happened there. So now I don't know what messed up your skin means and like what happened. Big things afterwards. Black and brown skin, got to be careful. Got to make sure you're seeing somebody that knows how to treat black and brown skin. That's a big thing. And follow the pre and post care. Like I said earlier, I was like, if somebody's not going to wear sunscreen, we won't even treat them. Like, we was just like, it's not worth it. Like, doing these things can make it worse if you're not going to like follow the pre and post care. So there's a lot of education that we do. You guys see, it takes me an hour to answer one question. We talk a lot, especially if they're in front of us. I'm like, we got to make sure you see this. And we send you so many handouts and videos and all the things, because we want to make sure people are informed that we're doing these things right. Safety is our biggest thing. I'm always like, I need my patients to feel safe, seen, heard, beautiful. Like, those are the things. So safety is the biggest one. Hey, from the UK. Hey, B. What did I do? Okay, I just talked about that. Someone said Pico laser sucks. I was looking at it and then I didn't. We went Aerolase. Guys, look at Aerolase. I love it. Pico laser sucks. Really, it says otherwise online. People like, I don't know. I wasn't like, obviously I didn't go with it. I thought about it, but we like Aerolase. We've loved our Aerolase. Aerolase is great. All skin types, all skin tones. No downtime with it. I didn't go with Pico. Is like really for pigment. Aerolase can work on so many other things. I think Aerolase is wonderful for acne on black and brown skin. Acne, dark spots, hair removal, redness, I have good pictures. I don't have them on right now, but I have like all the little DPN, the little flat moles. I got all those off my neck. So it's such a versatile laser. Very like, it just, no problems with it. Very safe. And we do it on everybody. So that's nice. And you can stack it. So we're stacking it again with the microneedling, with the chemical peel on the same day, with the hydrofacial, working on different layers on the skin. So people are able to see results quicker. Located in Los Angeles. So we got Mar Vista and Torrance in LA. And then in the Summerlin side of Las Vegas. Can you name a good night cream, please? B, Bumble, your Resurface RX serum, the Jossie that we have, or Retin-A. Those are going to be great. And then tell me what your concerns are, but that kind of like covers a lot. And then a moisturizer with that. Okay, Araceli, yes, Queen Info. What filler did I use? I talked about that one. It's market others. What's good for under eyes? Under eye, let me talk about under eyes. This is like one of the most commonly things that we do and get asked about. So under eyes. For volume loss, hollowness, sunkenness under the eyes, we can use filler or the natural filler. So if somebody's like, oh my gosh, I look like I look so tired here, I look sunken, that's when you can use filler or the natural filler. Filler if you don't get puffy under your eyes, you don't cry a lot, you don't have bad allergies, you don't retain water. If you have retained water around the eyes, do not do filler underneath your eyes. Period. It's not going to look good. It's going to, filler hydrates and binds water. So it's going to swell up and down with you. I had a wonderful girl today that I was talking to, and she wanted to do filler under her eyes. And I said, oh, I went through those questions. She's like, I cry. I was like, how often? And I was like, you know, maybe she's going to tell me once in a while, like once a year. She's like, just a few times a week, maybe on a good week. I was like, oh, you can never do filler underneath your eyes. It will just hydrate up and down. It will never settle. It will be so annoying, and it lasts a long time. You don't want that. Then you could also do the natural filler. Natural filler, same one. Draw blood from your arm. Spin it in the centrifuge, a spinner. It takes out your growth factors, your stem cells. We heat and cool that. We inject it. Wherever we inject it, your body makes new collagen over time. So this is a gradual thing. Gradually will get better. It works great. That's like under the eyes and smile lines are like the two main areas people come in to get the natural filler. What filler won't do is it won't change the color of the skin. So if somebody just naturally has darker skin there, I'm like, it's not going to change the color of the skin. I tell people that, and a lot of times after they're like, you said it wasn't going to get rid of my dark circles, but it got better. Like, what happened? It's because they're not sunken in, and so light reflects off their face a little bit brighter. So it's not going to change the color of your skin, but when it's not sunken, people will tell me, oh, I can actually use my concealer now, and the concealer like works. Whereas before I'm trying to use my concealer and it's not concealing. It still looks sunken. And so, yeah. Okay, so hopefully that helps. Other things for under eyes besides injectables, your retinoid at home, great. Your vitamin C in the morning, great. Microneedling, great. You can get up there. The bio refill chemical peel, that's all good. Fine lines, pores, texture. Sorry, I'm like thinking over here. Other things, Botox, if you're like, oh, when I smile, I got like, if you have a little line there, very, 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 very small amount of Botox to help minimize the creasing. You don't want to do too much Botox there, it'll pull down your eyelid. Okay. Okay. What's good for, okay, we talked about that one. Does any lip filler help with hydration? Yes, Brianna. So hyaluronic acid in general, like I was saying earlier, binds water, so it can help hydrate the lips. Yes, that helps. And there's different types of fillers that we use depending on the patient, their concerns, their goals, their natural, what they start with. So that's how we pick and choose which one. Okay, Carmen says she did 3 sessions of that pico laser, didn't help with pigment. I was hearing that from patients and like people before. I'm so slow to bring stuff on, guys. I am so slow. I have been in this for 13 years. I used to work in 2 med spas and we had so many devices, and like, I just did not like doing these treatments and the patients weren't seeing freaking results. And so I am slow. It took me a long time to figure out which laser we're going to start with. And Airlace has been great. But Pico, I've heard that from some people. I've heard other people that really like it. Again, they market it for pigment. I don't know. It's like iffy. So we talked about PRF. Yes, I did 2 treatments of PDGF under eyes and frown lines. It doesn't seem like it worked. 2 sessions. So PDGF, I can't really talk about because I don't do it in the office. Again, I'm slow to bring stuff on. That is not FDA approved in the United States for injection. So like, yeah, some people are doing it. I wouldn't. Like, it's not studied to be injected. So I've heard some people say they've had great results, not in our office. Hey, thank you, Fletcher. I hope you're doing so great. I've heard other people who have not great results. When stuff is new to the aesthetic industry, guys, I'm going to give you a pro tip. Don't be the first one to like test your face on it. Just don't, okay? I've been doing this a long time. Think about how long it takes me to bring something into my office. I don't need to be the first person jumping on things. I have been in several offices, well, 2 other offices, and worked alongside very like prominent providers worldwide. We go to trainings all over the world, and we would be trainers for these, all these big companies and doing research with these companies on products before they even come to the market. And like, sometimes these things come out and they are complete duds, but the companies will put a lot of marketing dollars. They like hype it up. So they get providers excited. They get patients excited. They get everybody excited to buy their thing. And then like the results end up flopping and like the product ends up flopping. And I've seen things have to be taken off the market. So I'm like, PDGF, like I'm not the first. I know Area Essence came out. I know PDGF like it's a big thing and everybody was hyped. And like people are like, can you bring it in? Can you bring it in? I have learned to like let the dust settle and then see, okay, is this really like working? Is this a thing? So yeah. Okay. I talked to you, Bumble, about the good night cream. Okay. Okay. Where I'm located, Los Angeles and Las Vegas. And then what filler? Oh, I mentioned that. Guys, I'm 50 messages behind. So I feel like I'm answering these questions and then now I'm like going slowly and seeing them. What I think of chin lipo, I want jaw filler, but my injector said my jaw muscles are too bulky. Chin lipo, if you have the fullness here, I'm not a surgeon, so I don't want to talk out of my lane, but like, this is where I'll tell people they have a lot of fullness. Like if there's like no jawline, no neck, like separation, a lot of fullness, that's when I'm like, hey, reducing the fat cells, the fullness, whether it's surgery, gonna be the best thing. You could do Kybella, but it takes for dang ever. I'm like, if you can do the surgery and suck it out, you're naturally gonna get a little bit of definition. Then, and sometimes it's not just lipo, it might be a neck lift. Like you got to talk to a surgeon so they can tell you the right thing. After that, then we can reassess and see if you need at that point to put filler, you can. We don't need any of it. But if you want, we can further define with filler after. Does the filler stay in the area you inject or will it spread throughout your face? It's not going to be spreading, Thomasine. It's not going to be spreading throughout your face if your injector is doing the right thing, choosing the right product, injecting it the right way, the right amount, and then you follow your pre and post care. So I will see people, I'm scrolling, I see people, I got filler and I got my lips done and they're massaging it. I don't tell people to touch anything. When we are done, I'm like, hands off. This is filler. It is malleable. It's a gel. If you're touching it, you can move it. We don't want to be moving it around. It is malleable up to a month later. Like, it's hard to move it at a month, but if you're doing hard gua sha, you can. Those first couple of weeks, if you're touching it, moving it, it's gonna mess up. I think a lot of injectors tell people to like massage out the bumps because they're using freaking old school products. I'm sorry, I'm not trying to be like, but like the old school products that I had to use back when it was old school and all we had, they would leave lumps and bumps. But like now, this newer generation of products that have been out the last 5 to 8 years, they integrate better into the skin. They're soft. You don't have to manipulate them and they're going to not leave lumps and bumps. I just know because I use them every single day in my practice. If I had to be dealing with lumps and bumps, I would be very annoyed. Guys, like I tell my patients, don't touch it. I'm like, leave the hands off. You won't see, if you feel a bump, come back to me at 6 to 8 weeks and I'll dissolve it. They might tell me they see a bump at 2 weeks. I'm like, okay, talk to me 6 to 8 weeks. When they come back, they're like, oh yeah, it went down. I'm like, I know. It just takes time. The old school products, I think they leave lumpy, bumpy. But a lot of people use old school products because they're cheap. And so, yeah, no, you got to go to the person doing the right thing, guys. Okay. How much is facial balancing run? I was mentioning this earlier. Y'all probably left in this call. Hi, Fletcher. I hope you're doing so great. I was saying in general, 4 to 6 syringes, but it's going to depend on your face. It could be less or more, but in general, 4 to 6 syringes is a good range. Usually 2 to 3 between here, 2 to 3 between here. And that is $975 a syringe. So around $4,000 to $6,000. I say 1 to 2 years. That's when you check in to do your maintenance. And when you do maintenance, it's not that you have to redo that full thing. It's usually about half of that. Okay. Fine lines and wrinkles. Fine lines and wrinkles. Lisa. Retinoid, sunscreen, vitamin C. That's your part at home. Red light therapy. Wonderful. If you can be consistent with it. That's really great. In the office, skin pain microneedling, the bio repill, Aerolase. Excellent. Those are great. You got to be consistent with your skin treatments. So yeah, I just did XERF. What do you think about it? I don't know what that one is, Carmen. I'm not for sure. I'm going to get Botox on my 11s. I'm nervous about how it will feel. It's not, it might feel weird too, right when it kicks in, but like you're going to get used to it. So when you're trying to do your Botox, how much Botox you do depends on how strong your muscles are, how big the area is, what you want the outcome to be. So I have people, everybody's dose is different. My dose is going to be different than yours and your twin sisters. You guys are going to have different doses. You twin sisters are going to have different doses. Just know that. Because like, and it depends on what they want. Like, not everybody wants to be completely flat. I have some people that are like, keep some of the lines because I'm in acting or I'm a therapist. And so we go lighter on the dose. I have other people like, freeze me up, Ginille. I can only get to see you once or twice a year. So I need this to last. And I don't care if I can't frown at all. I don't want to frown at all. So those two people are going to have very different doses. Somebody that has very bulk, I mean, I have pretty strong muscles, like very bulky doses, they're going to take more to like flatten out versus somebody that's like, oh, I'm not, like the girl today, she's like, she wanted Botox. I was like, I haven't seen you make one facial expression. Like, she's like, oh, I've just like trained myself to not to make hard expressions, but I don't really have them. I just want to be preventative. She's going to have a lighter dose. So it's going to, your dose is going to depend on all those factors. If your first time, you're probably going to be doing, I don't know, I don't see your face, 12 to 24 units in the frown, somewhere in there. 12 is very light, but you know, that's a little baby dose. You can still get your feet wet, but it's not going to do too much and it's not going to last long, but that's somewhere. But I don't think it's going to be this thing that's like super bothersome to you, like the feeling of it. The pokes takes a minute to do the pokes. Ice it, a couple pokes. It's not a big deal. The needle is tiny, tiny, tiny. In our office, we give you ice. We have somebody tap your shoulder to distract from the pokes. Or if they don't have that, you can use a fan. That helps, but it's very quick. RSL, it was dang it, we took all the questions down, so I gotta scroll back up. RSL was saying she had months ago. I think she was telling me about the under eyes. I'm trying to scroll to find that message. It just moved on me. If you had it months ago and you don't like it, RSL, I would go back and get it dissolved. Or at least have them assess it. See, talk to them about what's going on. I feel like one eye looks a little hollow. Oh, if one eye looks more hollow, it could be that you need more. So when we do under eye filler and any filler in the face, you guys have heard me say this today, we do it in at least 2 sessions. Do some, let it settle, reassess 6 to 8 weeks later. It needs to settle. You're going to have a little bit of a false idea of what the outcome is right when it finishes because you're swollen, you could be bruised. So that's why I tell people, I'm like, I need this to settle so I can like see what the result is once it's settled. If you're bruising and swelling while I'm injecting you, it's going to look more lifted than what the result actually is. So that's why we build it in. We build that second session in for the under eyes. I'm like, this is the thinnest skin under the eyes. So if it's still sunken, you could just end up using a little bit more to like get it more lifted. If your provider thinks that's the right thing for you, understand there are limitations to how much you can lift. We got to stay on bone. Sometimes people will be like, oh, like go right here. And I'm like, that's your eyeball. Like if I inject you right there, it's your eyeball. You don't want that. So you got to be on bone, but let them look at it. You could just do a little bit more. What's your favorite new school stuff for filler? New school? I mean, again, I'm slow to like do the new school things, guys. I mentioned that earlier. Someone said, what is considered old school? Regular, I don't want to be saying brands on here. Old school. I don't want to be saying brands. Old Juvederm, old Restylane, just old. The ones that are cheap. Okay, I wish you had people in Philly. I do see patients from there. I know. Okay. Let me see. Any recommendations? Sunscreen for black women without the white cast. Thank you. Oh, I should go grab mine. But if I go downstairs, my kids will see me and they'll be all over me. Look at the Jossie ones on our page. So we have a one that's like white with no cast, and then we have a tinted one. I like the tinted one. Right now I have on the white with no cast. I usually like the tinted one. My kid took it to school. I was like, what the heck, dude? The tinted one like gives you a little pretty glow. So, I mean, I feel like my skin glows without it, but it gives like extra glow. So both of those I really like. Okay, Melody. Does Botox help with facial tic Tourette's, especially around the brows? Yes, it can. I've had people to do that, and it just like relaxes the muscle from flexing so hard. Okay, Sarah said, how did you get rid of puffiness that's directly underneath the eyes, like by the waterline? If it's a fat pad, only surgery can get rid of it or tighten it. If it's a fat pad that looks like a little protruded and then there's a line underneath it, that's when we can use filler to camouflage the fat pad if you don't want to do surgery. And if it's like, when you smile and it's like kind of pouches, like a little bit like there, you could put like 1 to 2 units of Botox, just a very, very small amount to help stop the muscle from flexing so hard. And that'll help it not like bunch up. You just don't want to do too much or it'll pull down. Okay. I guys, if I missed the messages, I'm sorry. I'm going to try to scroll back up, but I'm trying to hit every one of them. Best treatment for jowls besides Botox and filler. Would microneedling help? No, microneedling is not going to help. Microneedling helps with like texture, lines, hyperpigmentation, acne scars, collagen, but like jowls. So jowls, guys, are like when this fat pad, remember I was showing you earlier, fat pad, this one keeps sinking down. It's like this. And so people feel like their jawline, like they have this heavy, I don't want to pull, I'm not trying to like add to it, but they have this heaviness here along their jawline. So microneedling is great skin, but it's not going to do anything for that. What we can do for jowls, and I do see a lot of people for this, and I've just been lazy, guys. I didn't go set up my photos. Usually I will set up the photos and I'll click through and show patient before and afters. You can go to the top of my page and you can scroll through different pictures at the top. Like there's different series that you can see, or our website or whatever, or just text me if you have questions and whatever. But jowls, to camouflage jowls, here's a few things we can do. We can do Botox into the platysmal muscle. This is the neck muscle. So into this is kind of like right where the jowl will run. So we Botox that. It'll give a little bit of tightening along the jawline. If you just have very, very lot of fullness, it's not going to be a neck lift, guys. But if you have just a little bit there, it's going to help give us some tightening. Other things we can do. Filler or natural filler into these marionette lines. You say, oh my God, sad. These little lines that make us look sad at the corners of the mouth. Filler there to camouflage like the front of the jowl. And then we call this area pre-jowl sulcus. So the area before the jowl, we're going to put filler right here to kind of hide it from the front. Sometimes I do it from the back, but from the front. And then you got to be careful you don't widen your face like this. So sometimes we'll have to do some filler into the chin, all to help it look camouflaged and balanced. And I've done some really good jawline, like it's like on every freaking patient. So when I'm doing their face, we're looking at the full face, but we can show you really pretty pictures of that. Okay, T-Money, hello, just coming in, new to all of this. Is not regular Botox and filler needing it every 3 months? Is not, I'm not for sure exactly what that meant, but Botox, usually people will do it 3 to 4 times a year. It lasts around 3 to 4 months, but it depends on your dose. I can get people to last a year if I go really, really extreme on their dose. Filler, you're going to do like 1 to 2 sessions of it. Let it sit. You're going to be good for a year to 2 years. Where you will be more consistent is your skincare daily, or in your red light, if you can do that at home. And then your skin treatments. That's when you're coming in on a monthly basis and like really working on the healthier skin. Guys, don't sleep on the skin thing. Like I know, I love Botox, I love filler. You're going to get some quick results with it. But the skin, when people see their skin better, sheesh, like the Botox and filler becomes an afterthought because their skin is just glowing. I'm saying even for myself to like be like, dang, like I don't have to be messing with it because my skin is just glowing. The patients are so much, they're happier about that than anything, more than anything. So don't sleep on the skin. Okay. Mikaya said, hi, how long does it take for swelling from facial balancing to go away? The worst of the swelling is like the first 3 to 5 days, but 2 to 3 weeks. After 2 to 3 weeks, you're going to have a really good idea of the results. Some people like it when it's swollen. So if they are like, oh my gosh, like right when we finish and they're hyped, or those first few days, if you are hyped, you are probably going to want to add more because it's swollen and then it's going to come down a little bit. So that's why I say, don't fall in love with this. Just don't hate it. Don't fall in love with it. Let it settle. Reassess 6 to 8 weeks once it's fully settled. Some people will be like, just do a little bit more because it's going to come down. No, we don't overfill here. Go slow. I'm not going to mess your face up. Period. Sorry. But yeah, 2 to 3 weeks, you have a good idea. If you follow the pre and post care we send a bunch of write-ups to you. Arnica, pineapple, avoid blood thinners, avoid alcohol. Try not to get super sweaty and hot. Do your icing. If you follow the stuff that we say, those patients are like chilling. They're like, oh wow, I was a few days, it wasn't a big deal. Oh, I put makeup on the day after because I had a minimal bruise. Or some people are like, I didn't. Some people are like, I had no bruising, I had no swelling. I'm like, you didn't have no swelling. But some people are like, it was completely fine. But they are the ones that follow directions. Do your pre and post care. The ones that are like, oh, I forgot, I've been taking aspirin, I've been taking fish oils, I drank yesterday. You're gonna bruise. And it's not a big deal to bruise, but it just, nobody wants to be dealing with that. It just kind of like prolongs, you know, you don't want to be looking at it. So anyway, and anybody can bruise, but just try to help the situation out. Okay, is there a cost range for Aerolase? So Aerolase so our membership program is $3.99 a month. That's when you come in, you have access to any of the skin treatments. You pick one for the month. You don't have to know which one. We can guide you on which one based on your skin concerns and what's going on and how you present. Aerolase laser, skin pin microneedling, hydrofacial, or bio repeal. So $3.99, pick one. A lot of people are comboing them the same day. So then if they want to like do Aerolase and skin pin, it's another $2.50 onto there. So just depending on what your concerns are. Some people are comboing 3 on a day. Face and neck and chest. If you do face, neck, and chest, it's another $2.50. So that is a skin program. We have it if you're like, I can't, you know, some people are like, I can't come every month, Ginille, because I'm coming from New York. And I'm like, okay, hi Sarah, thank you for the loves. So if you can't come every month, that is totally fine. We have packages. We also sell singles. Like the price for the single is the highest, really to discourage people. Like one is not it. One is not it. The price is the lowest for doing the membership because we want people to be on this routine thing with it. Packages, I think it's like $500 a session, and the single is like $550 a session. And then remember, the membership is $3.99 a session. Okay. I've had no filler. Where should I start? Alice, start with your skincare at home. So that's a skin routine. Retin-A or Jossie Resurface RX serum. And then your sunscreen. And then if it's filler, I gotta know more, girl. Oh, she said 38. Okay. Usually, so these are the areas I'm going to be looking at that are very common where we lose volume. Temples, under eyes through here, right here at the side of the nose. Thank you for the loves. You guys are so sweet. Corners of the mouth, maybe a little pre-jaw sulcus, those areas. So I'm kind of like, I am on my team thinking about where fat pads separate, where they're sinking, where we're losing bone. That's how we inject. We are not line chasing. So then our people look really good. They look natural because we're not just sitting here chasing one line. We're thinking about underneath the skin. We're thinking about how the face is aging. We're making sure things look balanced. We're not just plumping up lips and then chin is back and your lips are overpowering your lower face and they're saggy on the corners. No. We got to think about the whole picture. Biggest thing is like we can kind of just assess your face. Some people are like, I can't come to you, I'm in another country. I definitely will see people and they would just do the thing. Can you give me like recommendations, or like, hey, somebody said this, do you agree with it or not? So we can always talk about it. Nancy said her face is too oily for sunscreen. Try to get a matte one. It's important. It is important. I will just tell you, I don't know how old you are, Nancy, you're probably young, but you're so beautiful. But like the sun damage, even and it's harder to treat on black and brown skin. And so it's like, if you can avoid it, that's going to be the main thing. We can get skin cancer. So that's number one. And then the signs of aging that happen from sun damage, like the dark spots, the fine lines, like we don't want that. So that's what I'm going to say there. I'm in Dallas. I need to come see you. This will be my first time getting anything done. Sally says, I want facial balancing. I know, Dallas and Houston. I know. I'm going to come this year. I had some people that were like, you need to at least do a pop-up. So I will make that happen, but we'd love to see you. We do the virtual consults before you come in, go through questions and goals and tips on what to expect, how to prep treatments, start building out your treatment plan before you even come in. And then you prep, we make sure it's the right time. You know, what events do you have going on? Is this the right time? You can bruise, you can swell. What flights do you have? We're asking all your business because we just want to make sure whatever we do is going to fit in with what we're doing. Okay, how much to remove the flat moles on the face and neck? That is the laser, $3.99 in the membership. Or a package is what, $500? We have all the pricing too on the website. So I try to be like super transparent with pricing. I'm not here, I get it. Like people don't know. They're just like, what is it? Like, is it $200, $2,000, $20,000? Like we're not trying to like dupe anybody. The pricing is there. These are things I've been doing for several years. I really I have a pretty good hold on how much it's going to cost based on like the assessment. But I can do an assessment of just looking at your face, but it's really like sometimes people send pictures and I'm like, it's really not enough. Like me talking to you, because I gotta learn more about you. I gotta learn about all your lifestyle and all the things so I can make sure it fits. Because I have some girls that are just like, I want to do all the things. And I have other girls that are like, I don't even know if I want to do anything. And so I'm like, hold on. We just want to, I got to know more about you. But yeah, that was for, I don't even know what question she asked me. Okay, sorry. PRP EZ Gel. Normally, how many sessions are needed? At least 2. Mid to late 30s, I start saying do 3. You want to stack, or if you have like a lot of volume loss, hollowness, you want to do 3. Stack it the same area. You do like your sessions about 1 month apart. Best daily sunscreen. I use sunscreen daily with the highest SPF available. I love ours, Lisa. I love the Jossie one. I really started this to get a no-cast sunscreen for all skin types and tones. My favorite one is the tinted one, and it just like makes the skin glowy. I've done it on people way darker than me and more fair than me, and I really love that one. But the non-tinted one is great as well. So on our Jossie page. How long will it take to receive results from the natural filler? Some people will see it after 1 month, but it can take up to 6 months for the full results. Where I will tell people don't do natural filler is if they are like, I need to see it now. I'm like, okay, I'm not gonna do natural filler. This is not the quick thing. Or if they want something super structured, like I want to be chiseled, I want this like sharp, I want, what do they tell me? I want it snatched, I want like really highlight, or really like defined along the bridge of the nose, or super defined crispy borders on the lips. If I need it really sharp and defined, that's when I'm going with regular filler, because I need to use a sturdy product. This is good for like volume loss, under eyes here, like my cheeks, I've done it with, but it's not like super sharp. But I mean, I have a nice highlight. I'm not feeling sunken. Guys, if they wanted like sharp jawlines or like really angular chins, the natural filler is not going to be the one. Okay, Georgina said, what did she do to her under eyes to make it less sunken? I missed it. I've done filler, and then I've maintained it with the natural filler the past couple of years. Okay, it says 50 messages. I'm trying, guys. I'm trying. How about Sculptra? Sculptra's cool too. It just takes some time to see it. It takes multiple sessions. It's a collagen stimulator. Commonly, people do like temples, mid-face. People that have like more like overall general volume loss, hollowness, I feel like they see nice results with it. It's a little slow to me. I have it in my office and will use it. I tend to use Dilute Radiesse or the natural filler more in place of it. Sculptra and Dilute Radiesse, both collagen stimulators. You can't put either of them under the eyes, into the nose, or into the lips. So that's just something to know. She said quick pinch, nothing painful. Maybe maybe about Botox. Kels, I'm going tomorrow for tox. Any recommendations for hooded eyes? Yes. So they're going to do around here to help give a little bit of a lift. You can also do, I don't know if your injector is going to do this. I don't know how advanced they are, but they can put Botox like right above the eyelid to lift the eyelid. Another thing is don't get too heavy and too close with your Botox on the eyebrow, like on the forehead, or it will feel very heavy for you and like hard to lift your brows. It looks so bad. So don't do too much there. Lift it here if they're open to it. If they're advanced, they know what they're doing. Some Botox on the eyelid to lift as well. Fletcher said, love all your information. Thank you. Oh, she's a med spa too. Let's go, girl. Skin Philia said, hey, I hope you're doing so great. What about chin filler? I love chin filler. I haven't had it in a while, but I've been doing the natural filler. Chin filler, it just helped give me a little bit of length. My chin, you can even see in that photo before, that was 10, 11 years ago. Just shorter. And I used to, I didn't know, but like when I tried to take like cute pictures, I always had like my mouth open a little bit. I didn't know what I was doing, but I was trying to like get a little bit more length in my lower face. I also like chin filler for people that have, when they close their mouth and they have like dimpling. I'm kind of like making it a little bit more exaggerated right now. They have dimpling, it'll help relax the muscle. We also lose bone here. So, then it'll look more jowly and the chin is like this and the jowls are here. So I do a lot of chin filler on people. Thank you so much. Okay. What is best for mature lips for filler? You can do, filler, but I would go slow with it. Not too much. Mature lips, you just don't want to be putting too much. And then big things are considering right here, the corners of the mouth. You don't want to have like juicy, especially for a more mature lip. Here's what happens as we age. Like the whole process of aging with it is like the lips will start to get more wide and thinner like this. And so then they look wide and then these get this. And then our chin starts to sit back and then we get these jowls. So when we're doing lips, especially for somebody more mature, I don't want to just stick on juicy, plump, nice lips on you. And then these are deep. And then this is here. And you got these jowls. So think about it as the lower face complex. You got to probably put some here, maybe into the chin, maybe right here, just so everything flows. And then do some, let it settle, reassess. You can always do more later. You don't want to shove a bunch of filler into the lips. When people try to go too fast on the lips, puffy above, they lose their shape. You don't want that. So that's something. What lip filler does not leave lumps and bumps? I like Restylane Contour a lot. That's probably my favorite. Yeah. Okay, let's see. Getting laser hair removal. Should I wait to get microneedling? With the air lays, you don't have to. So you can do those the same day. But I don't know what laser you're using. So I don't want to, Eddie, I don't want to tell you like yay or nay without knowing enough about that. But we do our laser. So air lays is good. Again, acne, dark spots, redness, all the things, pigment, texture, hair removal. So that's really nice. I was doing a patient yesterday for her laser, and then she was doing the peel and the hydrofacial right after, and she's done several of these. She's gone for several months, so she comes all the time. And then she's like, I want to do like laser on my body for hair removal. And I was like, oh, that's great. She's like, because she came in for like pigment and like skin texture ish concerns. But she's like, oh, but like since you've been doing the laser, it got rid of like all this hair on my chin and my lip. And like now that would probably be really nice to do underneath my arms and in my legs. So that's really cool with the laser. Okay. I want frozen. Girl, I'm with you. I want frozen. Call me Nicole Goodman. I like to be frozen when I have it. It just lasts a long time. You can still show your expression. I asked my husband, I'm like, when I'm frozen, can you still tell I'm mad? He's like, I see your attitude through your Botox. He's like, yes, I see it. So yes, I love. Okay, huge pores and hyperpigmentation, microneedling, Retin-A, or Jossie Resurface RX, the Bio Repeal Chemical Peel. Okay, did I get them all? Do I have lip fillers? No, that's like the one thing I haven't done. My nose. I would do my nose because I keep doing these like black girl noses and they're all contoured and they look so nice and structured. But as I said, that's the only thing that kind of looks like my kids. They still got this like full nose here. I'm Filipino black. So I'm like, I'll leave it. Lips I haven't done, but I did these and this. And doing this in here, I remember my mom came, after I like did this in here, settled, whatever, she was like, you did lip filler. I was like, no, I didn't, Mom. But everything like around the surrounding structures around it were so balanced. She's like, no, you did it. I was like, Mom, I didn't. It just supported it, so it looks better. But yeah, I like lip filler. I don't want to make this bigger because then I don't want it to overpower my chin. My chin was already the thing that was a little bit weaker on me. Someone said, I woke up with dents for temples. I've been losing weight. Help. Hey, coach. I know. The temples, people sleep on. If you've seen my videos, sometimes I talk about this. I'm like, these are underrated areas. People don't think about this, but like, I think that's one of the biggest things that really helps. Undetectable look like people won't know, but this shows signs of aging. Like we lose volume here, guys. So when you put volume here, it's going to extend the highlight of your cheek all the way up. It also helps to frame the eyes. So the eyes look a little bit more supported. I don't want to say like, oh, it makes your eyes pulled up. The eyes look more supported. It looks brighter. People will notice it either when they're older, when they're like, they've lost a lot of weight, or they're older. But like beyond that, people just keep doing cheek filler. I'm like, no, don't just do cheek filler and then you're sunken right here. It looks bad. So yeah, you could do regular filler if you're like, I'm seeing this right now and I want to see an immediate result. If you don't need the immediate result, you can do a collagen stimulator like Sculptra, Dilute Radius, or the natural filler EZ Gel. I love temple filler. When I do my temples, two stories of temples, and then I'll go. But it's like such an underrated area. So one time after I did my temples, I went to my kid's school. He's K through 12, his school. And there's 2 times I went to school. One time I was there at Halloween, and the kids were like, what grade are you in? It was like an older kid. She's like, what grade are you in? I'm like, 27th grade, honestly. And then another time I went to pick up my kid from the nurse. They called me. I went to pick him up, and this lady was like yelling at me. She's like, stand outside. I was like, why is this woman yelling at me? I hear my kids yelling, by the way. And then when she came to me, she's like, what are you here for? You need to fill out the form. I was like, I'm here to pick up my child. She's like, I'm so sorry. She's like, I thought you were a student. It was because I just did temple filler. It was just because I did temple filler. And around that same time, I went to check the mail. No, somebody came to get something to sign. And he was like, can your mom sign for this? I was like, sir, this is my home. I am 38 years old. So yeah, temples, I like it. Okay, eternal please. I love the way you completely explain how everything works. Yes, I'm really here to help like educate. I tell people I'm not here to be like, do Botox and filler. Now, I love Botox and filler. If you're going to do it, we're going to make it look right. We're going to make it look right. And you got to be safe about it. There's a lot of things that we have to consider. We can't just be, it's not just poking the needle in there. Also, it's not just poking the needle because each of our patients, we know so much about them. Like, we become like family. Like, it's really cool to hear all the stories and see what they're doing. One of our patients yesterday, she was a 55-year-old Black woman, and she was showing us how she's going deep sea diving, and then she's going to take a second career as a flight attendant, and like just all the stories we hear all day. Like, there's so much. It's really cool to like connect with people and to hear, you know, they're regular people. They just want to look and feel like their best self. They're not trying to transform their face and not trying to look like every dang celebrity. That's not what people are doing. They just want to look like them. They want to look fresh. They want, like, that's it. I'm like, what do your friends and family say when you get treatments? And they're like, nobody knew, but they said, you just look, did you change your hair? Did you change your makeup? Oh, I got carded when I went out. Oh, did you go on vacation? Like, they can't clock it. They don't know what it is. Somebody else was like, I told them, I saw you. And they were like, yeah, but I don't know what you did. And she was like, you just look good. I'm like, that's the point. Like, we don't need nothing to stand out where they're like, who did your lip filler? Who did your smile line filler? No, they're not going to be able to know. So that's the point. She said she's 60. Oh, are you here? Okay, there you are. Thank you for sharing with us. Okay. Wearing sunscreen consistently with the results. Will wearing sunscreen consistently help the results from the chemical peel last? Definitely. If you're not going to wear sunscreen, don't do the treatments. But like, even if you just wear sunscreen, that's already going to help. That's already going to help your skin. Like, I tell people, I'm like, you can't ever do skin treatment or you never want to do any of this stuff. That's totally fine. Use sunscreen so you don't get skin cancer. And 2, it's going to just help your skin long term. Even for family members that will text me, what can I do? I'm in whatever state, random, and I can't see you. I'm like, wear some sunscreen. And they will text me 2 months later. They're like, wow, my skin, like, the darkness was fading within 2 months. I'm like, I know. You just have to wear sunscreen. So that's a big one. Okay. Moving to Vegas this month. Can't wait to book with you. I can't wait to see you, Dominique. What would you do for moles around the neck? We do the Aerolase laser, or we have a bifurcator, so we can zap them. You can see our dermatology nurse practitioner for that. Okay. Oh, hi, Luca. If you have other questions, call us, text us. I'm going to see these children. I also need to like film. I've got like a million videos I want to be making, but it just takes me forever. If you have questions, call us, text us. We can set up a consult. I should have opened up more consult times. All my consults are like getting booked out. You can also see, I think Samantha, one of our other nurse practitioners, has some availability. You guys, she's excellent. Don't feel like you have to see me. Everybody's like, I want to see Ginille. I'm telling you, they reroute their flights to come to LA and they end up going to Vegas to see her. They love her. So yeah, if you have questions, let me know. Fact, as you said, I have a lot of pimples around the mouth. What can I do? I think it's hormones. Somebody said, I don't know what that is. Curcumin peel. Okay, I know what you're saying. I would do the lasers, excellent. The laser, the pill are excellent. Spironolactone if it's hormonal. We do clindamycin topically for acne. We do your Retin-A or your Resurface RX. So these are things like we get on the right skincare program, and a lot of it is like not doing too much, but it's like using the right products, a benzoyl wash. So thank you so much. God bless. I didn't know it was you, girl. I didn't know you were here. I think the videos were easy for you to make. You do such a good job at making them. It just takes me time to like sit down and like to do the thing. I've been making them a long time, but thank you. It takes me a long time to do it. Do I offer NCTF for under eyes? No, I don't know what that one is. What do I recommend for forehead wrinkles and nasolabial folds? I'm new to this, 31. Botox. This smile lines, you can do the natural filler, or if you've been listening, you probably heard me say you got to think about the whole face. 31, you're young. I would do like the natural one. You can do regular filler if you're like, oh, I need to see this immediately. But 31, I'm like, you're young, do the natural one. That's so funny. I didn't know I was talking about you, and I just loved your story, and thank you for sharing with us. And all your cool things. Okay. I think I got them. I'm trying to make sure I didn't. I might have to go to LA to see you. I would love to see you anytime. Wish you were in Houston. I know Houston's going to be, Dallas and Houston going to be next. What do I recommend for deep hollows besides PRF? Regular filler if you don't get puffy, don't cry a lot, don't have bad allergies, don't retain a lot of water around your eyes. I have ptosis of one eye, so a little in the eyelid would work. Yes, ptosis means like eyelid is like a little lower, so we do Botox there to lift. Just gotta have a steady hand. You can't be shaking, and yeah, so just make sure whoever you're seeing is doing the right way. Lily, I want to say you're pretty. I hope you have a great night. God bless you. I hope you are doing great and you're so beautiful. And we talked about the sunscreen, alternatives to under eye filler, the natural filler, PRF EZ Gel, the one made from your body's growth factors and stem cells. Best for marionette lines, traditional filler, or your natural filler, or dilute radius, a collagen stimulator. So that was for Tara. Okay. I think I got him. Oh, oh gosh, let me see. It's saying I need to, it said, am I active on live still? It says, can you explain the membership, what it includes? Please, I missed it. Come in on a monthly basis. We choose one of the skin treatments, depending on your skin concerns. And we do that for that month. We can stack treatments the same day if you'd like. We can do your neck and chest if you'd like. We can do your whole body if you like. You also, you get discounted rates on the EZ Gel. So that is really nice. The natural filler is $25.50 for 2 sessions. In the membership, it's $9.50 each. So you get a pretty big discount on that. And people like that. So that is really to focus on like skin health, collagen stimulation, long-term results is the skin membership. And then you get discounts on the Jossie Skin line. So that's really nice. Okay. I think I got them. I'm just trying to scroll. How do I manage to keep my teeth so white? I don't know, bro. Oh, my husband is an oral surgeon. He developed a toothbrush called Pheno, and it's a full mouth toothbrush, and that is actually a really great toothbrush. So, yeah. I finished second PRF injections. My under eyes look so much better already. Lips look fuller too. Sarah, I like to hear it. I really like to hear that. And it's just gonna get better. It's gonna just get better. Just keep that in mind. Oh, Tara said the first gift you've ever sent. Thank you. So sweet for the bear. That's so sweet. Okay. Can PRF build up under eye hollowness? Yes, that will help. If you guys have already left, I'm sorry, because I said I was going and I came back to answer these questions. I want to come in to the U.S. to visit your clinics when I'm concerned about the safety in the U.S. I wouldn't do it. Don't come right now. Like, let's not. But we can start on some skincare. I mean, just I would wait till we see you. I'm not trying to get, I don't know. We talked about the laser to remove the moles. Yes. Okay, I think I got them, guys. Sorry. Botox for lifting effect versus anti-wrinkle benefits. Can you speak to that? Yes. So Botox, like lifting areas are going to be like, oh, when you smile, my eyes close in. Botox can like give a little bit of lift here. It's not like crazy lift. This is another area where can like help kind of lift through the middle if you frown down a lot. Where else? For anti-wrinkles, I mean, these are all like wrinkly areas. So that's going to kind of lift and soften wrinkles. This is going to soften wrinkles. It's kind of doing similar things. Depends. Biggest thing is like, what are your goals? Where are you seeing lines that you don't like? Or where do you want to lift? You tell me, and then I can tell you what we can do if we can do. Because you can do Botox all over your face. I can do nose wrinkles. I can do here to like stop a gummy smile. I can lift the upper lip. We can stop the dimpling in the chin. We can lift the corners of the mouth. We can tighten through the neck. Sweaty hands, sweaty feet, sweaty underarms, sweaty scalps, migraines, TMJ symptoms, headaches, clenching, teeth grinding, jaw pain, traps, Botox for like tight traps through there. So a lot of stuff we can do with it. She said, when are I coming to Dallas and Houston? I don't know. Guys, I don't even know why I do any of this. I feel like I'm a crazy person. I'll be like, let's try something else crazy. Let's just go. But I need to go because so many people ask me. And I know I see a lot of people from there, so I need to. I'm not trying to hit somebody's. It said I'm not trying to block anybody. Sorry. Mid-face. Wow. Okay. Mid-face Botox is not going to lift. So if you're trying to if you have like volume loss in through the mid-face, that is more of a filler or the natural filler. So Botox, think of it as stopping the muscles from like contracting, like from flexing so hard, from flexing. You don't want to stop these or your smile won't go up. So if it's mid-face, volume loss, sunkenness, hollowness, that's when you're going to do filler or a collagen stimulator, the natural filler. Okay. I know it's hard. And like, I'm sure me talking this out, like if you don't know anything about it, it makes normal sense. Like, I don't know, if you don't know it, you don't know it. It's totally fine. But like, it can be like a complete foreign language. So if you're like, I want to talk this all out completely, like we can go one by one. I also have a bajillion videos on there trying to explain stuff. She said, I will see you in Dallas. I will totally let you guys know when I'm doing it. Sarah said, it's been so educational. Thank you. Okay. I know I said I'm going to see these babies. I appreciate you guys. Thank you. Oh, thanks for my hair. I need to get it cut. God bless you. I hope you have a great day. If you have questions, text that number on top of my page. I see every message that goes through. I've seen some people are like DMing while I've been on here. I will get those too. I appreciate you. I hope you have a great day. I will talk to you guys later. Bye.